So, welcome everyone to this session where we're going to be talking about the cost of healthcare, specifically focusing on the different types of healthcare in different countries and whether, for example, in the USA, where it's a more paid system, if that system of the healthcare is justified. Okay, so what does everyone know about how healthcare works in the US? Is anyone any prior knowledge by any chance? Maybe put
Feel
something in
free to put your answers in the chat box, or if you know anything, you can also unmute yourself and speak out loud.
Yes, that's correct. It's a private healthcare system, so there are, it can be expensive for certain people. Yeah, that's true. Any other ideas? Maybe about, I don't know, maybe you've heard of insurance and health insurance, and maybe that's how people pay for their insurance. Like, does anyone know anything about that? Or in specific countries, what it's like in different countries, maybe if you're not in the UK or if you're not listening to us from the UK, then how is it in your country? Anyone? I think it is quite a difficult topic, so maybe we'll just start and give you some ideas. Shivas. Okay, so the United States does not have a national healthcare service, unlike other countries, including the UK, Canada, and Germany. Most Americans have their healthcare paid for by their employer, which is often included as a benefit in job packages. And citizens who have a low income or are over 65 are able to access government-funded healthcare through Medicaid and Medicare. Around 8.5% of the US population did not have any healthcare insurance in 2017. This largely improved in 2010 when the Affordable Care Act was passed, allowing a more widespread provision of benefit packages. Yeah, so these are just some key overview of facts of how some of the UK, Canada, and Germany, for example, are national healthcare service providers, which means they're free for the entire country. And in some countries like America and the United States, they have a more paid system, and you can see that they do have some government options or government-based options within this non-free system, but overall, it's a mostly paid, monetized system, unlike the UK.
Yeah, so we'll move on now. We're going to talk a bit about whether healthcare is a right. And this is something which is sort of one of the main kind of arguments behind the debate as to whether private or public healthcare is better. So here in the UK, we have the NHS, the National Health Service, and the primary aim of the NHS is to provide healthcare which is free at the point of use to everybody. And that's one of the main founding principles of the health service. And many people argue that healthcare shouldn't work as a free market because health is something which is different to other products. You know, in most products, it's based on supply and demand. If you want a product, then you'll be able to obtain it if you have enough money. But many people argue that because healthcare is it's a universal thing, everybody needs healthcare. It's not something that should be controlled in that way. And people argue that patients shouldn't try to look for or try to search for the cheapest or best quality healthcare, and different healthcare companies shouldn't really compete in that way because of this reason. And also inequality is something which is a big concern. As we saw before, there was a small percentage of the American population who didn't really have access to health benefits or kind of they weren't able to access healthcare in that way. So that's kind of one of the reasons why inequality can become worse if healthcare isn't provided to everyone. And also taxes is another reason. You know, the NHS is largely funded through taxes, and sometimes these aren't enough to cover the cost of all the staff, the resources, etc. But you know, private healthcare also offers many benefits, as we'll see later on in the session. These include better quality healthcare because there's more money for funding, for resources, and you know, this can mean that for the people who can afford this care, they can receive a better quality of care, better treatment, more choice, and also in many cases better paid staff. For example, in the USA, doctors are paid some of the highest rates in the world. So we're going to ask you now, what do you think? Do you think everyone should be entitled to free healthcare? Do you think healthcare should be a universal right? Or do you think, what do you think about this trade-off that we currently have between quality and accessibility of care in countries where a national healthcare service or system exists? The main principle behind that is providing healthcare for everyone, making it accessible to all people. But in other countries, sometimes quality is prioritized. People are able to receive high quality healthcare, but this does mean that accessibility is restricted. So perhaps now in the chat, if you could put in your ideas. I know we've got a few people just joining. So we're trying to answer this question here. What do you think about entitlement to free healthcare? Do you think everyone should be entitled to it? Or do you think having a better quality healthcare service or system is better? So we've already got someone in the chat saying, talking about justice. Free healthcare allows everyone to be given the same quality of care. And someone else has added onto that. It should be a right because of justice, which is one of the medical principles. So yeah, that's a very good point. And I wonder if anyone could try and link it to some of the other ethical principles as well, beneficence, non-maleficence, or autonomy as well. I think especially autonomy, there are some arguments you can make for both. Yeah, so justice, yeah, it's one of the main reasons why the NHS is what it is, why it allows all people to kind of access healthcare. It's because of the fact that everyone requires healthcare, and according to the NHS, their principles, it should be a right to all people. But then again, quality might be limited in that sense. So we've got someone saying autonomy, patient has the right to choose their healthcare in private healthcare. Yeah, that's very true. As we can see, better quality healthcare might be provided, but also wider choice of healthcare potentially. People are able to choose their own doctors sometimes. And if there are lots of treatments which are available offered by different companies, if there are lots of drugs available, for example, then patients will have the choice to look at different ones, see what advantages they offer, and make a decision for themselves. Someone said, does working for a private service go against justice? And yeah, that's an interesting argument. Perhaps it doesn't. Perhaps, this healthcare is still provided to everyone based on their ability to pay. If people can pay, then they can still access healthcare. And even people who can't, to some extent, in the United States, for example, still have access to certain government-funded schemes. So it's not like they're completely restricted from having healthcare. So yeah, does anyone have any other ideas, perhaps linking to beneficence or non-maleficence as well? I think perhaps maybe something which might be interesting to consider is the idea of quality healthcare, and what you think about that. Is it better or more important to have a good quality healthcare provided to you, or just is it better for everyone to have healthcare provided to them? If you were to make that decision, then which would you prioritize? So Dan, I wonder if you have any ideas on this.
Sorry, which specific question? Because there was a few questions.
Just the bottom one here about whether quality of care or accessibility of care is more important, or which of those do you think should be kind of prioritized?
I mean, personally, I believe that someone's commented, but I think personally, I would go for quality of healthcare, because see, it's difficult, because if there's a good quality, then maybe the accessibility is not so great, or maybe if it's very accessible, maybe the quality goes down. So I personally think the quality should be good, because whoever is accessing this healthcare should be getting a decent enough experience from it and should be well and should be healthy through this healthcare, rather than prioritizing everyone be able to access a healthcare which is not so great.
Yeah, and I think that's one of the arguments. That's just one of the debates that's really had with regards to private and public healthcare. With private, providing high quality healthcare usually, but that some people argue that that's more important, being able to provide high quality care, being able to allow a wide range of choices for patients. Some people would think that's more important than making it accessible to everybody. But yeah, we've got some more comments. Someone said autonomy, patients able to choose between types of appropriate treatments, giving all the options and best advice rather than having to choose between many options for the same treatment based off the provider's sales pitch. Yeah, and that's a very interesting point as well. If, if we are having a more private element in medicine, is that something that should be, is that really something we should tie together, i.e. like, corporations, advertisements and medicine? Is it right to advertise medical products? Could that lead perhaps to biases? Could that lead to exaggeration, which could potentially compromise a patient's ability to access, facts and really understand the effectiveness of a certain treatment? So that's another interesting point, and one of the perhaps disadvantages of having a healthcare system whereby where there are many different providers. So yeah, I think we'll move on now, perhaps, and we're going to talk about whether people should be denied healthcare. So we've got a little example here, and I'll just read it out. So Erica, a 25-year-old patient in the United States, has recently immigrated from Eastern Europe. She's gained US citizenship, but due to the fact that she is unemployed, she is ineligible to obtain a healthcare package. One day she notices that she has a headache and a violent cough. She goes into a hospital where you, the doctor, take a scan of her lungs. You realize that a tumor has developed in the right lung. Although not urgent, it requires removal through surgery, but this will cost $90,000. She tells you that she simply cannot afford the cost of the surgery and will wait instead until she's able to save up enough money. So the question we're asking now is whether patients should ever be denied healthcare if they cannot pay. Perhaps you've heard of examples in the real world, and whether a doctor's duty should override patients' abilities or inability to access treatment in that way, and also what problems could this lead to? Obviously, there's the obvious problems of patients, not being able to access care, not being able to get better potentially. But are there any other problems, like longer lasting problems, or other impacts that this could have that you can think of? So yeah, we'll just give you a minute to think about that. And if you know any other kind of examples where this is the case, then please do mention them. So we've got someone in the chat saying, pay for play healthcare undermines beneficence. If doctors receive percentage handbacks from medical companies, how can patients trust when they are the center of their treatment, and when doctors might be influenced by the money they can receive from using one product over another? And that's a very interesting point, which and that's another issue that people raise, another concern, the fact that if money is involved, that could make people focus less on kind of quality and accuracy, and trust, building a relationship with patients based on trust and facts. But instead it could lead to other incentives, i.e. money, which could make people less aware of the what they should be aware of, i.e. the facts surrounding a particular medical treatment. So yeah, I wonder if anyone has any ideas surrounding this kind of case study, or any of these questions. Do you think it's ever right for a patient to be denied healthcare if they cannot pay? And what problems could this lead to? So we'll just give you a minute or two to try and think about that.
I think there's a comment in the chat, I think, which says pay for play healthcare undermines beneficence. If doctors receive percentage handbacks from the medical companies, how can patients trust when they are the center of their treatment and when doctors might be influenced by the money they receive from using one product over another? And another one says, I think in a context such as this, it is imperative to act quickly. And the fact that financial factors could potentially decrease one's quality of care is an abhorrent symptom of capitalism.
Mhm.
Um, I mean, Shivas, what do you think about this?
Yeah, so we've got this comment here is the last one that's been commented. I think it's very interesting. Um, and, it is kind of a criticism of capitalism in a way, I suppose. The fact that, financial factors, the money is the incentive here rather than wanting to um, wanting to do well, wanting to provide a good quality of care for people. And that could potentially decrease when people are instead focused on money. But then again, money is a major driving factor. And the reason capitalism is successful is because people are able to kind of work hard to produce products because of their this financial incentive. They want to earn money, and that allows them not only to be able to afford potential resources to produce them, in this case, provide medical care, but also it encourages them to perhaps try and produce healthcare, try and provide healthcare. Um, so it's an interesting debate. Um,
I think, sorry, I just wanted to add something where someone added, how can patients be sure that they are the center of the treatment when doctors might be approached by pharmaceutical companies to prescribe one drug over another? I think there is, in America, there is a system, I don't know what the word is, but basically you can have either the branded drug or the pharmaceutical drug without the brand. And apparently that it's, I think, 3-4 times cheaper than the branded drug, just the drug on its own without the brand. And some doctors are actually contracted by some pharmaceutical companies to only sell the branded version of that drug, which means that patients are going to have to pay more for a drug which they could buy just by themselves. And some doctors don't mind this, but some doctors are heavily offended by this because they don't want to increase bills for patients just for their own gain. So I think that's also a debate which is quite relevant, and especially in this country, I know that obviously that doesn't happen, and the NHS is more than happy to give away branded medicine if the need is there for that specific medicine.
mhm. Yeah, and then many people would, argue in that sense that because the NHS doesn't have, doctors in the NHS don't necessarily have a financial incentive, they will therefore act in a way which is more open to patients. They will try and actually see what's in the best interests of the patients, rather than trying to just prescribe the most expensive medication, for example. So, if any of our American friends who are, watching this now, if you have any more information about your healthcare system and what you think about it, then we'd love to hear that as well. But there are pros and cons to both sides, and that's kind of what we're discussing here. Someone has mentioned in regards to this case study, it's really sad because her problems could get worse. Worst case scenario is she dies before she can have the surgery, or because she didn't have it, just or because she didn't have the money. And it's even harder since she's unemployed. Getting that kind of money may take a while. I'd wish that doctor's duty should override her financial situation. And it's an interesting thing because this isn't just a case study. Unfortunately, this is the reality, especially in countries like the US. We have an article here where someone did actually die because they avoided going to hospital to get treatment for a particular condition, and it is sad, but it's a reality. But what we've also got to remember is that you know patients, even though they might be deterred from trying to seek medical care, there will be a wider range available to them. That's just one of the advantages, and because of more progress at the top, i.e., firms are able to go and look into more innovation for new medical procedures. That eventually makes it cheaper at the bottom as well for people. Regular treatments, regular medications. So it's not just a situation where the poor cannot access medication and they're completely barred from it because of this system, but it's just more of a fact that the advantages that are seen at the top take perhaps longer to trickle down to the bottom for the regular consumer of medication. Someone said, can she not undergo surgery and pay later? Perhaps she could. I don't know exactly how the system would work, but it's just an example to illustrate the fact that sometimes people are deterred from undergoing surgery, receiving medications just because they can't pay, and that's perhaps one of the disadvantages of privatized healthcare. So yeah, perhaps we'll move on now. So Sinan, I wonder if you want to just kind of look at the advantages and disadvantages. Actually, someone has just put one more comment, so perhaps we'll just read this first. You've put, it's quite hard to justify paid at point of care from a moral standpoint. In the UK, we don't pay doctors very much in the context of training and responsibility, let alone against what doctors make in the USA, yet we are able to provide better quality healthcare for more people. Perhaps, but also you've got to remember, if you look at this from a doctor's perspective, I'm sure all doctors would want to be paid enough, and many people argue that they're not paid enough in this country. And perhaps that financial incentive would not only encourage doctors to work harder, or be able to provide better treatment due to more resources that are available to them, but also if more people are encouraged to become doctors, or more people are encouraged to to provide healthcare as a doctor, because of the financial benefits that are available to them, then that could improve the quality of healthcare that's given, perhaps. So that's just another argument. So yeah, Sinan, I wonder if you want to go through these points.
Yep. So, for example, we talked about the pros and cons of public and private healthcare. So one case for the public healthcare system is that there's a overarching theme of equality. It ensures that everyone has access to basic services, and which are essential for living standards, because some things, for example, in a private healthcare might be available for people, but they might not be necessary, or they might not be. The reason they've been made so available is because they're not so important, but in the public healthcare sector, such as the NHS, all of it is accessible. Positive externalities, obviously good health for the whole population increases the labor productivity, this increases the economic gain for the country, but we're not going to go too much into that. But it also has externalities, are basically a third party effect on anything, which don't, basically the effect is completely unrelated, but it is an effect because of the thing that we're talking about. So for example, the NHS has an effect on the economy. They're not hugely related, and so it could be called an externality, and in this case it's positive. Adverse selection. So in the free market, the unhealthy will be most willing to buy insurance, and this pushes up premiums and makes it more expensive. Although this obviously can have both advantages and disadvantages. Merit to good. Also, good people may underestimate the benefits of getting checkup or getting treatment. So that might be a problem, because if for example, if people are underestimating the benefits of getting checkups or getting treatments, then they might not, in a private sector, they might not do this because they think that, what's really going to happen? They're going to say the same thing every time. In a public healthcare sector, they don't have to pay for these checkups, and so they're more frequent, and people will actually be inclined to go for a checkup if something is wrong. And so that can actually lead to early detection of some diseases, which could be prevented and treated early. And the last one I want to mention is public service. So healthcare is not like most private goods. Profit incentive isn't needed. Obviously, doctors are working for for the reason that they want to help people. They're not out to make huge amounts of money, and it's not like they're not compensated for their jobs either. Of course, there are lots of debates about they should be paid more, but doctors do want to help people, and so they will, in a public service, be even more likely to help people. And because they're in the public service, perhaps it means that the reason they didn't go into the private service is because they want to help people on a larger scale. I'm not saying that people in the private sector don't help people. I'm just saying that that's a possibility. And consumers struggle to choose between different doctors. I'm not entirely sure what that point means, Shivesh.
Yeah, well, I think just the fact that if there are a wide, not just doctors, but products in general, if, you know, for example, in the case of drugs, if there are multiple pharmaceutical companies who are offering different drugs, then it will be confusing for consumers to try and choose between them. If they're just looking at ones with the lowest price, then, you know, those might not necessarily be the most effective. Same with doctors. Sometimes if there are different doctors, they might have different costs to provide their service. It might be difficult for them to choose between doctors, you know, based on their ability to pay for them or pay for certain treatments. And therefore, you know, in a more public setting, it might be easier for them because they just have one doctor who, you know, would treat them the same way any other doctor would, really. So they don't have to worry about, you know, kind of not being able to reach that high level care, perhaps, because of the doctor they have or because of the amount they're able to pay.
Right. Someone's actually put something in the chat saying, does that mean the mortality rate in the US is higher than the UK? I'm not entirely sure. I don't think that, obviously the public and private healthcare sector difference will have some sort of effect, but to be honest, I'm not entirely sure which one has a higher mortality rate, because I feel like lots of factors affect a mortality rate, not just the state and the availability of a healthcare system. So I'm not entirely sure. You'd have to probably search that up. Okay, so we're going to go through some cases for the private healthcare sector, the benefits of the private healthcare sector. So it's more efficient. The reason is that they have incentives to be efficient because they're getting paid higher amounts, and almost all of their salaries based on how many clients they get rather than the government payment. They have a greater incentive to see more patients more effectively, so it might be more efficient. It also acts as an alternative for people who might be a bit more wealthy and might be able to afford a private healthcare. They might want to use it as an alternative to public healthcare, where people aren't prioritized, people are seen as equally, and in private healthcare, because some people can pay more, obviously, you know, by default, the people who would be paying more would be prioritized, because obviously the private healthcare sector in the UK has much fewer people that it treats than the public sector. The demand keeps rising for the private sector. So public sector is struggling to keep up with the increasing demand for healthcare, and obviously with increasing population and a couple of other problems that obviously, you know, increased demand, which was to be expected. But in private healthcare sector, the demand is less. It's not. I'm not sure if it's decreasing or not, but it's a lot less than it is for the public healthcare sector, because not everyone can afford it. So they're able to manage this demand a lot more. And so people who make the shift might see some big changes. I was reading this article where a newborn baby was born with TGA, where two main arteries in the heart let blood flow in the wrong places. Essentially, deoxygenated blood was pumped around the body. The death rate in babies with untreated TGA is very high. NHS spotted and set up care for the baby mother even when the baby was in the womb. They performed an 11-hour operation, the baby survived and have now just turned 5. Family was so grateful for the great quality of care and mentioned how they'd be bankrupt or worse if it hadn't been for the NHS. Yes, so there are certain cases where the NHS has absolutely saved them. And to be fair, it's not like the NHS is subpar. The NHS is an excellent healthcare sector and a service. And we're very lucky to be able to access the NHS in the UK. We're just saying that some people might believe that private healthcare sectors and the private healthcare system might be more beneficial for some people because they feel this way. But the NHS is very excellent, and the doctors that work under the NHS are really skilled. So private healthcare sector, it's not limited. With a limited budget in the public healthcare sector, for example, in the NHS, the public healthcare may have to ration services, but in the private healthcare sector, as we discussed in a previous session with CCGs and other areas, you know, private healthcare sector is much more well off, and the bureaucracy of the government. So in the public healthcare sector, obviously the NHS is government funded and government supervised. Private healthcare sector is not, and so some people might suffer from bureaucracy costs in public sector, whereas they won't in private. Someone said, "Does the royal family use the NHS?" Ooh, that's a really good idea. Question.
The NHS, the royal family, I believe, don't use the NHS. They have access to private healthcare, and I think, you know, in the last few weeks, I think Prince Philip was at hospital. He attended a private hospital, I think, and received, you know, private treatment. But, you know, obviously that is because of the wealth of the royal family. They're able to access those kind of treatments, and I think it's also important to note, if you don't mind me, you know, some people, I noticed in the chat, you're talking about, you know, US mortality rate, for example. We've got lots of statistics here. It's higher than Britain's. And it's true that many people, you know, don't have access to certain treatments. They wouldn't be able to afford certain treatments, and therefore the NHS has been very helpful for them. But I think what's also important to realize is that the fact that the US spends so much on healthcare because of private, you know, people who pay privately, means that the US's healthcare that they can provide is, you know, some of the best in the world. The most innovative treatments, you know, the most new treatments that are being developed, they're all done in the US, and that's because they have almost unlimited, you know, financial capacity to do that. So in terms of innovation, you know, the US is definitely, you know, far ahead. And with new and upcoming treatments, there are many experiments being, or, you know, trials being done in the US. And, you know, basically, if you have enough money, then you can go there and you can undertake these treatments where that wouldn't be possible in this country, for example. So it's not necessarily the fact that the US offers worse healthcare. It definitely doesn't. And in many areas, it offers far better. It's possible for them to offer far better quality care than in the UK, for example. But the fact is, healthcare is just generally more accessible in the UK, and that's why you know, that's one of the reasons why people are happy with the NHS. It's something which is able to be used publicly, although in terms of innovation, perhaps it's behind. So yeah, someone said, doesn't that indicate US healthcare costs more? The US healthcare system does cost, it does cost a lot, and a large part of that, you know, is to do with administration costs. It's not necessarily just the cost of healthcare, but the fact that everything needs to be itemized, everything needs to be billed to individual people. It's not necessarily as efficient, but it can be more effective. So, you know, someone's put, yeah, true innovation is good, but for every profit, there is a deficit. The advancement of technology and care comes at the expense of poorer demographics. But as I was saying before, many people, the whole idea of a private healthcare system is that if there is more development at the top, then eventually, you know, newer innovations, newer treatments will be able to be passed on to poorer people, who will, you know, gradually be able to access, you know, these advantages quicker, perhaps. So, you know, there are advantages to both. Someone said the Countess of Wessex was rushed to a local NHS hospital after a placental abruption when her first child was born. I think they use the NHS for emergencies. Yeah, perhaps they do in some cases, but I would assume, you know, usually they do have royal doctors as well. They have their own kind of healthcare professionals who look after them. But, you know, it's in the UK, there is a wealth divide. There are people who are wealthier than others, and therefore they're able to access this treatment. But, you know, overall, that can lead to benefits, you know, when we have private investors, but it can mean, you know, that can come at the expense of inequality. So yeah, sorry, Siddhant, to kind of interrupt there, but it's just, you know, there are, it's an interesting case to make, but we can see in this table that there are both cases for and against kind of public healthcare, with regards to innovation, limited budget. Generally with private healthcare, there's no kind of restrictions, there's no boundaries. People can, you know, experiment as much as they want. There's more choice, more alternatives, but with public healthcare, that's restricted to allow more people access to what is available.
Yeah, exactly. I completely agree. I mean, there are lots of things here which we need to think about, and it's not a one solution fits all, and there are lots of factors that affect the need and demand and efficiency of both public and private healthcare sectors. I think we should move on from this slide because I think we've talked about all the topics.
Mm-hmm. Yeah, so I think next we're going to talk a bit about pharmaceutical companies, which has been something quite relevant now with the pandemic, obviously. So we know that, vaccinations, vaccines have been developed by these pharmaceutical companies across the world very quickly. And, we were able to produce effective vaccines within a year, which is basically the fastest we've been able to produce vaccines ever for any kind of disease before. And this was not only because of the urgent need for the vaccine, but also because of more government investment, donor investment, and a large part of these funds did come from the private sector. So, some firms like AstraZeneca have pledged to sell the vaccine at a low price, which only just covers their costs. And a large part of this is they don't want to be seen as profiting from the pandemic. They want to be seen as, they want their main aim to be helping people. But other companies like Moderna, who are significantly smaller than AstraZeneca, they've priced their values much higher and intend to try and make a profit from this. So, first of all, what are the pros and cons of competition between pharmaceutical firms? We've talked about this before, really, as well. But, is it an advantage for there to be many pharmaceutical firms who are all trying to compete with each other to provide the best service, the best products, or should pharmaceutical firms be able to profit from the sale of vaccines, or should profit be their main incentive here? If they're not profiting, could that perhaps limit the quality of their vaccines that they're producing? And also, should they be sharing their resources or technology? If we weren't competing in this way, would it be better instead to just invest all our money into a centralized vaccination program where all our researchers are able to work together to come up with a vaccine? And what are the advantages and disadvantages of that? So I wonder if anyone knows about this already, or they have any ideas regarding any of these three questions that they'd like to mention. Silan, I wonder if you have any ideas?
Honestly, this is quite a difficult question. I'm not entirely sure. I think, especially with the pandemic, maybe they should be sharing the resources and technology. I'm not entirely sure about sharing profit. And obviously, we should, maybe it is a good idea to have a pool of money from which everyone can draw resources to build up ideas. However, I think that would reduce the competition between the companies. And obviously, if you've done any economics or anything, competition is what drives companies to be better, because there's only so much you can lower prices. And after prices have been lowered to the maximum they can be lowered, after that, you need to focus on quality, efficiency, and sort of customer care. And if you stop competition from happening, that won't happen. So I don't think there should be some sort of pool of profit. I think competition should still be happening. Someone said competition is best for the customer. Exactly. That's exactly what I was thinking. So that's my 2 cents on the issue, but I'm not entirely sure.
I think, there are quite a few pros that competition can provide here. If we have lots of pharmaceutical firms all competing against each other, all trying to produce products which are better than the others, then obviously that's going to drive innovation. That's going to drive these firms to, really provide the best possible care. People are, if these firms do want to make a profit, then they are going to, honestly try and produce the best quality vaccines they can. They want to try and make the most effective vaccines with the highest success rate so that they get the most sales as possible. And, potentially that could be better than just having one kind of main vaccine producer where profit isn't necessarily a concern because they know everyone is going to buy their vaccine. It drives innovation, it drives quality, and it could result in lower prices as well for consumers. And yeah, so I think, in terms of pharmaceutical firms sharing their resources and technology, obviously that could provide many advantages in terms of scientists being able to share their ideas. They're able to share their data and produce, the most effective vaccines. So it could offer advantages, but that would remove the element of competition, trying to be better, and therefore improving quality overall. So we're going to move on in a second, but someone has just mentioned the concerns about the AstraZeneca vaccines, especially in other countries. Yes, and this is something which I do have, an opinion on. I think, there have been issues, especially in Europe, in mainland Europe, around the AstraZeneca vaccines. Many people were worried about blood clots, but eventually the European department, the association which was responsible for judging the effectiveness of these vaccines, they indicated that there wasn't really a link between these blood clots and the vaccines themselves, and they were safe and effective, and therefore, vaccine uptake was able to be resumed in Europe. In the UK, they were obviously approved much earlier on, and as we're not a member of the European Union anymore, we were able to just approve them and go ahead with them. And I believe, today I found out, I think it was half the UK's adult population is now vaccinated, which is an incredible number. And it's actually one of the highest rates across the world. There are only a few other countries which are, at that level or higher. And whereas Europe, especially I believe in Germany, they're, worried about having a third wave now. And also politicians were skeptical, which didn't really drive public enthusiasm for these vaccines as well. So there are concerns of this, and perhaps the UK did a better job at trying to convince people of the effectiveness of vaccines, or perhaps even if they were less thorough, they were the fact that we wanted to drive this vaccination program, the fact that it was so heavily condoned by the government, so heavily emphasized, is why we've been so successful in that field. So yeah, perhaps it's an interesting point, but I think we'll move on now. So Siddhant, I wonder if you want to take this.
Yep. So obviously you might have seen in the news that there was an outroar at the lack of pay for healthcare staff, or the sort of low pay that the healthcare staff are getting despite the amount of work they're doing. And at the beginning of March, UK Prime Minister Boris Johnson announced that certain NHS healthcare workers, including nurses, would only receive a 1% pay rise. Now, although 1% is a pay rise, quite a few people were upset that it was only 1%, because the amount of work that the NHS did for the UK, and especially in the corona times and the pandemic times, it was really quite a few people felt that that was really unfair, that only their efforts were going unacknowledged with only a 1% pay rise. So what consequences could a lack of pay for healthcare workers lead to? I'm aware of the time, so maybe we'll just take a few points really quickly. So any ideas for these two questions? And could a more private healthcare system have helped to solve this issue? So I'll start off with the first one. What consequences could a lack of pay for healthcare workers lead to? Someone said, my mum and aunt are NHS nurse staff and they were furious people could go on strikes. Exactly, that's true. Obviously money is an incentive for people to work. In the NHS, quite a few people are very altruistic, and so they want to work to help people. But obviously, people do need to be acknowledged for the work they've done. And a lack of pay would mean that they feel like they're not being acknowledged for the work they've done, and that could be really demoralizing, leading to an overall drop in productivity. And as you said, some people could be so outraged as to actually put on strikes or protest, or just not come into work, which would be very dangerous for everyone. And for the second point, could a more private healthcare system help solve this issue? We have to think of both sides here, because you have to realize that, first of all, yes, possibly that in a private healthcare system, they would have been paid more, they would have been appreciated more. But you have to also realize that not everyone would have got the quality, not the quality, but the accessibility of healthcare in a private system that they would have done, that they did do, in fact, in the NHS. And obviously in the pandemic time, it was very important that everyone had access to healthcare. So they were on top of their medications, make sure that they were able to stay safe if they had any underlying health conditions. And if it was private, maybe people wouldn't have been able to afford healthcare and get checked up. And in that case, may have been spreading the virus without knowing it for some reason or the other. So I think there is a plenitude of ideas and concepts to consider. But being a doctor, money doesn't really matter. When you're a doctor, you feel happy when you treat a patient, and money doesn't bother that much. Okay, so that's a good point. Obviously, doctors have a very altruistic profession by nature. They want to help people rather than have any sort of major capital gain. That's completely true. I do believe that doctors, the reason you become a doctor, and I'm sure lots of people here are thinking of becoming doctors, nurses, or someone in the medical field, is because you want to help people. But that's true. I say, first of all, I think it's very important to acknowledge that money is not just something that people want to earn. You know, it's something people need to live, basically. And A, and B, the other thing is money. You do need it for some sort of acknowledgement is a good thing. Especially when people are working so hard. And when it comes in the monetary route, you know, if the acknowledgement is coming from a monetary route, then some people, that's why some people were so outraged that it was just 1%. And I don't know if, you know, obviously people were clapping and things, and apparently some people found that offensive as well, because of the fact that rather than clapping, people should not go. I think I read an article where they said, a nurse said that, or a doctor said that they hated the fact that people were clapping simply because of the fact that rather than clapping, they should focus on not trying to spread the coronavirus, because even though they were clapping, some people were still going on holiday or something or the other. I mean, you can find the article online. I'm not exactly sure where I read it, but you know, in either way, some people felt that it was almost insulting to only get a 1% pay rise. Although I completely agree with you that doctors are very altruistic by nature, and that's why they've become doctors, is to help people rather than look for monetary value. Shivas, do you have any you know,
Yeah,
contributions? Because that's a difficult question.
it is difficult, and I think what's also important to consider is that although, you know, as you said, doctors are by nature altruistic, they have to be for their profession. Um, you know, money is an incentive for everybody. It's not that doctors don't care about money at all. They do. Everybody does in this country, because we live in a capitalist society where, you know, you need money in order to live, in order to, you know, move up in society, um, and therefore it is important, I believe, to acknowledge the work that doctors do by paying them more. Of course, this isn't easy, and of course, this decision was made in order to um, you know, prioritize other sectors of the economy. It's not easy for the government right now, and of course, you know, Boris Johnson, other ministers in the government are receiving that you know, they're not receiving much support, because whatever they do, there is always someone they can't please, and it's very difficult in that way, you know, to reward the NHS workers in this situation, because mainly because of the fact that the government is who is providing them with their pay. And that's why perhaps with this second question, a private healthcare system or a more privatized healthcare system could provide benefits in that sense, more pay for doctors who thereby would be more incentivized to work more, not necessarily work more, but be able to provide better treatment to patients, be able to have a more comfortable and easy life, which in turn would, you know, be able to improve the quality of care they provide. So, you know, there are two sides to the coin. It's a difficult debate to have, but you know, it's something which has received a lot of criticism. Yeah, we don't have too long left, so there's just one last example that we're going to go through. It's one that we've kind of looked at before. So, Sinan, I wonder if you just want to quickly go through this one.
Yeah, I think we're going to go through it really quickly because we have less than 10 minutes left. But So two patients have shown up at your hospital with COVID-19. They both require immediate ventilation. However, there is only one ventilator remaining in your hospital. Edna, aged 88, is a widow with 4 children and 12 grandchildren. She's been diagnosed with lung cancer and was expected to die in the next month. However, Edna does not wish to be put on ventilation. Max, age 25, is suffering from liver disease due to alcoholism. He recently attended a party with over 100 people and subsequently caught COVID-19. You've also discovered that he has not paid taxes for the last 5 years. Max does wish to be put on ventilation. So what would you do? And you can see what is going to happen if you pick Edna or Max, if you save either one, the ethical issues behind it and ethical conundrums. So, for example, do you save Edna? And if you pay Edna, for example, it says Edna pays for the NHS and Max doesn't. Also, Max broke lockdown restrictions, which may be, which may make you ethically inclined to support Edna, and Edna has a large family, non-maleficence. So, if you save Edna, that would mean that there would be the least emotional harm on the family. If you save so Edna, it said that Edna is likely to die anyway, whereas Max still has most of his life ahead of him. And this would possibly be supporting beneficence, where he is only 25. And so you're causing him the most good because you're trying to save a longer life. And Max wants to be saved, whereas Edna doesn't. And because that's his autonomy, and Edna's autonomy said that she didn't want to be put on ventilation, maybe you should do this. So someone's put justice on autonomy. And I completely agree that it's not our place to make these decisions. And I hope we won't have to ever make decisions like this in the medical field. But you have to, A, respect the autonomy of these two patients because they've each expressed their wishes. And you have to agree with justice that all patients are treated equally. Shivas, I think that's really, I don't think people are saying much if we, oh, right, but Edna doesn't want ventilation, doesn't the fact that when you put her on ventilation, doesn't respect autonomy. Yes, exactly. So you have to agree with her decision. What she said is more important than what you think. You may have advised her on going into ventilation, etc., but if she doesn't want it, then you can't force her. So I think that's what counts the most. So, Shivas?
Yeah, I think we'll move on now. I think it's just an example to show the different factors you'd have to consider in addition to the fact, as to whether patients can pay or not. Yeah, so I think perhaps we'll move on. Yeah, so we've got a BMAT essay question just to finish off really, and it's one we've kind of looked at before about whether private hospitals deny patients their rights, and it's just an excerpt from a paper, yeah, I think perhaps we'll just we won't really discuss it too much, but we'll just go through some of the points. So I wonder if any of you have any opinions on this. Or just any kind of short views that you'd like to express regarding this question, and then we can just discuss them and see what we've got on the board. So if you want to support either side, or if you have any points for either side of this question, do private hospitals deny patients their rights, or do they support them? So if you have any suggestions, please do put them in the chat, and then we'll go through them. Yeah, in fact, we don't have too long left, so maybe I'll just put them up and then you can add to them, because I'm sure, a lot of them are things we've discussed already. The first one, really, the main one, is to do with inequality. I think that's the main factor that people will consider when they want to talk about private hospitals, private healthcare. People are discriminated against based on their wealth or income, and this links to justice, of course. Fewer private hospitals may mean that private patients have restricted access to certain facilities, although I don't think this is really often the case. It's usually, in a country like the US, it's not that hospitals aren't available, it's just the fact that people often struggle to pay. And that brings us on to the next point: patients may be turned away if they can't pay. We saw in the case study from before the damage that can cause. Patients may not be able to make complaints as well. someone has put in the chat, I think that private hospitals have an underlying incentive to treat those who can pay, which undermines justice, in my opinion. Yeah, so I think that's true. But of course, there are many advantages to this. Obviously, increased funding will lead to more resources provided. It's the same with anything, like, for example, if you look at schools, private schools tend to offer more resources and achieve better results than schools which are than public schools, than comprehensive schools, for example, selective schools. And that's mainly because of the fact that they have this flow of income, really, that they're able to allocate to their resources. They're able to provide more care, not care, more, but better education. It's the same with healthcare. So perhaps the fact that less people can access this, it's a trade-off between that and being able to provide better care. Some people might argue that, but private hospitals could support patients' rights, or allow patients more liberty with their healthcare. There's less waiting time, and that could link to beneficence as well. People are able to obtain treatment more easily, perhaps, in that sense. More investment, better quality treatment, and also an ability to choose their doctors and their treatments, which again links to autonomy. So, as we can see, there are arguments on both sides. And perhaps to finish, we could just ask you, if you think, if you agree with let's say, public healthcare, if you think that the NHS should remain a mainly government-funded sort of healthcare provider, please could you just put up your hand, perhaps, so we can see. So this is whether if you believe that the NHS should remain, as it is, publicly funded, despite the disadvantages of that. Yes, we've got quite a few people. We've got 1, 2. I can't really see exactly. I
6.
think we've got 6. Yeah. Sorry, it keeps scrolling up.
7.
But yeah, maybe 6, 7 people. So I think actually most people in the meeting perhaps agree with that. And perhaps if you could, put your hand up if you agree the opposite now. If you think that we should try and move towards a more privatized healthcare system, or try and include more private funding in our system. Right, we've got 1 hand up. I don't know if that was up from before, but that seems to be less popular. So yeah, I think we've had a very interesting session today, and I think most people would agree that trying to provide healthcare to everybody is something which is really important, because healthcare is something everybody needs. So that's why many people are very proud of our NHS. But we can see also that private services, private healthcare systems can offer many advantages in terms of innovation, new treatment, which can be experienced by everyone, if managed correctly, if these new treatments are made more accessible. But yeah, perhaps, there are countries which use a mix of the two systems. In France, for example, they have private elements in their healthcare system, in Germany as well. So, and even in the UK, we do have private healthcare for those who want it. So, there are advantages to both systems, and perhaps kind of mix of the two is a useful method to have. But, we'll see in the future how the NHS changes. There are increasingly more private elements in the NHS to try and increase funding, especially. So yeah, it's an interesting debate, and we hope that you've learned more about these issues now. So yeah, that brings us to the end of the session now, and we would just like to point out that many of you may have obtained our the links to our sessions from Instagram, but we're moving now to emails. So if you do follow us on Instagram, please do send us your email address. Or do email us, in fact, on the medical debate, and tell us that you'd like to be added to our mailing list, so we can send you the link via email instead. And yeah, if you do have any questions, please do email us or DM us. And also, please do subscribe to our YouTube channel, because we're putting up more and more videos of our sessions that we've had in the past. And those will be uploaded up there for you to see. So please do subscribe. The channel is just called The Medical Debate. So yeah, thank you very much for attending, and we hope to see you next week. And yeah, please do join us for our future sessions, and please do follow us to keep up to date with everything there. So yeah, thank you very much, and we hope to see you soon.
See you next week, guys.